Maturation is defined as the process of bringing forth of the young, which comprises of the multiple transformation in both uterine and the cervical function. There are four phases: quiescence, activation phase, stimulation phase, and the involution phase. First stage of a labor, following are the major events during the labor. Gradually increases the uterine contraction, retraction, dilation of cervix, effacement of the cervix, lower uterine segment formation. Dilation of the cervix, structural components of the cervix, smooth muscle 5 to 20%, collagen, ground substance. Predisposing factors like softening of the cervix, fibromuscular glandular hypertrophy, increased vascularity, accumulation of fluid in between the collagen fibers, breaking down of the collagen fibrils by enzymes collagenase and the elastase, change in the GAGs. Factor responsible: uterine contraction and the retraction. Polarity of the uterus, that is coordination between the fundal contraction and the cervical dilation. Upper segment contracts, lower segment and the cervix dilate. Fetal axis pressure, contraction of the circular muscle of the uterus. Fetal podalic pole, vertebral column, well fitted fetal head, stretching of the lower segment, dilation of the cervix. Uterine contraction, hydrostatic pressure in the four waters, dilation of cervix. Downward thrust of the proceeding part of the fetus and upward pull of the cervix over the lower segment. Eversment. Muscles of the cervix are pulled upward and merges with the lower uterine segment. Premigravidae, eversment precedes cervix dilation. Multipare, eversment and the cervix dilation occur simultaneously, lead to the expulsion of the mucus plug. Lower uterine segment. Anatomical features developed from the isthmus of the uterus. Boundaries support the physiological retraction ring in the labor. Below, fibromuscular junction of the cervix and the uterus in labor. Anteriorly, peritoneum. Size and shape 7.5 to 10 cm cylindrical. Poor retractile property. Thinning of wall. Relaxation of the muscle fibers to allow the elongation. Contraction and the retraction during the labor. Descent of the presenting part. Clinical significance. Receptive relaxation. Formation of the complete birth canal along with the fully dilated cervix. Expulsion of the fetus. Through this segment, caesarean section is done. Implantation of the placenta in the lower segment. Poor decidual reaction in the segment facilitates the morbid adherent placenta. Obstructed labor, the lower segment is very much stretched and thinned out and rupture. Postpartum hemorrhage if the placenta is implanted over. Events in the second stages of the labor. Propulsion from the full dilation until the head touches the pelvic floor. Expulsion since the time mother has irresistible desire to bear down and push until the baby is delivered. Latent phase of the labor is followed by the accelerated phase. Forces downward by uterine contraction supplemented by the voluntary contraction of the abdominal muscle. Upward, elastic recoil of the tissue of the vagina, pelvic floor, bony and the soft tissues of the birth canal. Counterbalanced by the power of the retraction. Increase in contraction and the retraction, the upper segment becomes more thicker with the thinning of the lower segment. The expulsive force of the uterine contraction is added by the voluntary contraction of the abdominal muscle, called bearing down efforts. Events in the third stage of labor. Birth of infant to deliver the placenta is the third stage of labor. Placental separation, placental descent to the lower segment, placental expansion with the membranes. Placental separation, retraction, surface area of the placental side to its half, bucking, shearing force between the placenta and the placental side, which brings the ultimate separation. Two ways of separation: central separation, splits. Detachment starts at the center, leads to the retroplacental hematoma. Vaginal separation, Matthews Tenkin, starts at the margin and more frequently. Separation of the membrane. Loosely attached membrane to active part thrown into the multiple fluids attached to the lower segment are already separated during its stretching. Separation is by the uterine contraction and the weight of the placenta. Expulsion of the placenta. Contraction and the retraction of the uterus forced down the placenta to flabbily lower the uterine segment or the upper part of the vagina. Voluntary contraction of the abdominal muscle bearing down efforts or by the manual procedure expels placenta out. CCF is most likely in pregnancy at the third stage of labor. Pressure inside the uterus is in the third stage is 100 to 120 mmHg. Latent phase of the labor is followed by the accelerated phase. CCF is most likely in pregnancy at the third stage of labor. Second stage of labor starts from the full dilation of a cervix. Expulsion of the fetus increases in the contraction and the cervical dilation. They are seen in the second stage of labor. from full duration of service to complete birth of the baby is second stage. Birth of infant to the delivery of placenta is third stage of labor. Pressure inside the uterus in the third stage is 100 to 120 mm per Hg.